name is Catherine. I'm going to clean my hands. My name is Kayla, and I'm going to be your nurse today. How are you doing? Doing good? All right, I'm going to close this curtain. Can you tell me your name, birthday, and age?
My name is Catherine. I was born 2010. My birthday is May 13th, and I'm 10 years old.
Okay, and I'm going to check that with patient's ID band to make sure that it matches. All right, I'm going to be doing a musculoskeletal assessment today. So we're going to I'm going to be looking for any abnormalities, any tenderness, or lack of range of motion, okay? Okay, all good? All right, so I'm going to start with my inspection and palpation. And so we're going to start with the head and move all the way down to your feet, okay? So I'll start with the head, and I'm just looking for symmetry, making sure everything looks symmetrical, and making sure that that I don't see any swollenness or redness. And we're going, I'm feeling for any warmth. No warmth, that's good. All right, do you feel any tenderness? No? Okay, can you open your mouth for me and close? I'm just feeling this mandibular joint open again. Feeling for any crepitus or cricking. Do you hear any cracking or any tenderness there? No? All right. So the head's good. Now I'm going to do the spine. And so, I'm going to do the neck first. So I'm going to palpate the vertebrae. And can I get you to look down? Okay. Any tenderness? Okay, don't feel any lumps or hardening. All right, look up. All right, we're going to test range of motion in your neck. So can you look to the left, look to the right? Can you look up and down and put your ear to your shoulder? Okay, good job. All right, now I'm going to look at the spine. And so I'm going to get you to stand up for me. And we're going to stand right here. All right, and so I'm going to get, I would have my client remove their shirt, but we're not going to for this video. And so I'm just feeling down the vertebrae. This patient's backbone protrudes. She's very skinny. Any tenderness? No? Okay, now I'm going to get you to bend over, and I'm going to be observing for symmetry of the shoulders. And I will be looking at symmetry of the hips and the C-like curvature of the thoracic spine, and the lumbar spine sticks out just a little bit right here. But I'm not noticing any signs of scoliosis, and so that looks good. So you can stand up. Okay, now turn out. We're going to check the range of motion of your hips. Okay, so can I get you to put your hands on your hips? All right, so we're going to rotate without moving your hips. Rotate from side to side. Okay, good job. All right, and can you bend side to side? Ooh, that's my back popped. All right, so that's good. All right, and you already bent over, and that is it for the back. So you can come sit back up here. Okay, let's see. Now we're going to look at your arms, and I'm going to start with your elbows. And so I'm feeling the joints here, and you just tell me if you feel any tenderness. Any tenderness? No? Okay, I'm going to get you to put your hands out like this. This is pronation, supination. All right, good job. And can I get you to extend your arm, extend the other, and then flex? Okay, good job. So there's no hyperextension of the elbows. All right, and now I'm going to look at the wrists, and I'm feeling all these little joints. You don't happen to have any history of arthritis, do you? No? Okay. That's good. Do any family members have arthritis?
I'm just finding out.
Mom, yeah, mom has some arthritis. Okay. All right. So now we're gonna look at your hands, and I'm gonna get you to flex them and extend. Flex, extend. Okay. And can you hyperextend? Not your shoulders, your arms. Doing back like this. Okay. Good job. All right. Let's look at your. You can stop now. All right. Let's look at your fingers, and I'm just feeling all the joints in the fingers. I'm not feeling any swollenness or tenderness. Okay. No heat. This one. Okay. All right, now we're going to check the range of motion in your fingers. All right, so I'm going to get you to do this. Spread your fingers out. Just relax. That's called abduction. And can you put them back together? That's adduction. All right, and can you flex them and extend? Okay, and I want you to grip my fingers as hard as you can to test the strength. As hard as you can. All right. Patient has good strength in her hand, good grip. Okay, you want to go. Okay, and can you move your thumb away from the rest of your fingers? Okay, and now put your thumb to the base of your pinky finger. Right here. Okay, good job. All right, we already checked your hips and we did your shoulders. All right, now we're gonna do your knees. So I'm feeling the joints in the knees, making sure there's no tenderness. All right, can you stick your knee out straight? Okay, and so that's flexing and extending the other one. Okay. All right, I'm gonna get you to lay back on the bed. I'm gonna give you a pillow. Here, let's get back just a little bit. All right, now I'm gonna test the range of motion of your hips, and so I'm gonna bring this knee up like this, and it lays out flat, like this. Okay, can I get you to put your heel on your shin? Okay, put it back down. All right, we're gonna extend it back out, and I'm gonna flex your other knee, your other hip out. And can you put your heel on your other foot? Can you lay it out? Okay, good job. All right, now I'm going to be looking at your feet. I do have one more thing I need you to do. Lay back down. Okay, can you lift your right leg up as high as you can? Okay.
I can't do it.
We've got another leg. Okay, without using your hands, let go. Just stick it out. There you go. All right, there you go. Good job. Now you can sit up. All right, now I'm gonna check for your ankles and feet. So I'm feeling all the tendons in the ankles and all the little tendons in the feet. Any tenderness? No? Okay.
Get used to this.
Okay. All right, so I want you to, with your ankles, we're going to test dorsiflexion, flexion, and so first I want you to push as hard as you can against my feet. Okay, now pull.
Against your feet?
Against my hands, pull. Okay, good job. Can you extend your foot like this, and then pull it back up? Flexing. Okay, do it again. Extension and flexing. All right, you can rotate. Do this one too. Extend and flex. Okay. And can you do eversion, which is kind of like that, and stick them out the opposite way? That's inversion and eversion. Okay. And you flexed. Again. And can you rotate them around? All right, turn and put your heels together. And point your toes out. Like this. good job. We're all done.